In this video, what I'd like to do is discuss the female genitalia, and we really have to start by looking at the external genitalia, which may seem a little bit uncomfortable in a class context, but the truth is, if you are going to see a patient in the clinic, unless you are in the OR, you're not going to see their internal genitalia. So we have to be familiar with both internal and external structures. You'll notice on this model that the skin is transparent. So if we flip this female over and we kind of zoom in on her genitals, this is kind of pelvic exam mode, we've got a couple structures that we can see. We have this opening right here, that's the vagina. We have this little opening right here, that's the external urethral opening. That's where the urine comes out. And then we have several other structures that I want to point out to you. One of these is this little guy right here. That's the clitoris. And the clitoris is basically, it's dense with nerve endings. It's analogous to the tip of the male penis, and it's involved in sexual arousal. So we can further divide the female genitalia into a couple more points. If we look at this part right here, this is the common term for it is the hood, but its actual anatomical term is the prepuce. This is analogous to the male foreskin. And if we look at this area here, this is called the vestibule. And vestibule, if you go to the sort of origin of the term, it basically means like an entryway. So it kind of makes some sense, right? It's sort of, the vestibule of a house would be like a lobby where you're going to enter this place and then you're going to go off somewhere else. Well, guess what? The urethral orifice and the vagina are in there. So you're entering this place and then you're going to go somewhere else. So in addition to this, we have sort of these pink parts out here. This is the labia minora. Labia means lip. And minora is basically the more tender skin on the inside. Outside of that, you'd have, when you look at a female naked, you'd see skin on the outside of this sort of this flap-like stuff. And it's hard to see in this model because in this model, the skin is transparent, but this would be the labia majora. And again, it just means lip. And if you think about, you know, what lips look like and how they come together, it makes some sense that that was the name for the structure. From a developmental perspective, the interesting thing about the female external genitalia is that it has a lot of similarities with the male genitalia. And that's just in terms of its origin, of course, not in its morphology. Like, they don't look the same, but they have a lot of traits in common. So when we look at the female external genital anatomy, the clitoris is an analog to the tip of the male penis. The labia minora is actually erectile tissue, and that stimulates sexual arousal and climax, and that's analogous to the body of the penis. The labia majora is involved in protecting and covering reproductive structures, so it's analogous to the scrotum. And what I mean by analogous is these are all coming from the same developmental position, and then they turn into different things depending if you have an X or Y chromosome. And there are a couple other structures that we'll see. The ovaries are analog to the testes, and the bulbourethral gland in males is analogous to the greater vestibular gland. Those glands secrete a lubricant, and their output will actually be on the female external genitalia. In fact, you can kind of see them right here. And they're involved in basically secreting lubricant that would be involved in intercourse. Now, what I want to do is the internal anatomy of the female reproductive system. One thing I want you to notice, and you don't need to know the names for all of these, but you'll see all this fascia, which is supportive tissue that's surrounding the female reproductive structures. Now, some of that's just kind of fill in the hole in the perineum, the hole in the, or the perineum, that hole in the pelvis, that, so that your guts don't fall out your butt, basically. So some of it's going to fill that void, and then some of it is actually holding these structures upright. And you can think about, since we're looking at a reproductive structure, if it bends over on itself and gets a kink in it, it's going to be much harder for the woman to conceive, not to mention that there could be pain involved too. So everything's anchored pretty well by a series of fascia and ligaments. Of course, this can go over the top, right? So there are certain disorders where you've got too much connective tissue, and if you've got too much connective tissue, then your structures are kind of getting tied down, and that's also going to lead to issues with conception. So as we look at these structures, I want you to see sort of where they are in space. Note that the uterus, which is right here, is located behind and above the bladder. And this makes sense if we think about where the external openings are, right? The urethral orifice is further anterior, it's further towards the front, and the vagina is more towards the middle. And on the other side of the uterus, we have the rectum. So it's kind of sandwiched in between those two structures. And this becomes important if we start to think about if there's any kind of damage to the uterus, be it from childbirth or be it from whatever. Any kind of damage can damage these surrounding structures. Furthermore, if we think about like cervical cancer or something like that, one of the first things it's going to try to do is invade the surrounding structures. Okay. So your uterus is a muscular organ, and basically it's got 3 layers: an endometrium, a myometrium, that's the muscular layer, and then it's got this perimetrium, which that term is pretty much never used. As we're looking at layers of the uterus, this endometrium is mostly something that's going to build up over the course of a month. And that's the layer that's shed when a woman menstruates or has her period. So it's interesting because it is a tissue layer, but it's actually a tissue layer, the most of which is routinely shed. The opening from the vagina to the uterus is called the cervix. And the cervix, if you were to do a pelvic exam, what you'd find is that cervix is hard. It actually feels about like the tip of your nose. It's a pretty firm structure, and its whole job in life is basically to keep sort of the gross stuff from the outside from getting into the uterus. And if we think about things like sexual intercourse, there is bacteria involved, right? You can't have bacteria-free genitals. I don't care what you put on them, and please don't try to get rid of all the bacteria. There is going to be bacteria. There is going to be stuff that enters the vagina, and we want to keep it out of the uterus, especially in the event of a pregnancy. If there was a baby in there, we really don't want any bacteria getting in there and potentially affecting the fetus. The vagina is smooth muscle, and it's lined with a mucous membrane, and that's for both immune protection as well as lubrication. And it's got rugae in it. Remember where we saw rugae before? Rugae are involved in expansion. This makes sense because if you're thinking of basically an infant coming out, that structure is going to need to be able to expand very significantly. The vagina has 3 functions. It carries out the menstrual flow, it's the birth canal during labor, and it has that sexual function of being able to receive the penis. All right. So on the sides of the uterus, we have these uterine tubes, which are also called fallopian tubes. And those connect the uterus to the ovaries. So here's an ovary right here. And the ovary is where the gametes are made, where those eggs are made. The interesting thing about ovaries is that they don't really have a physical connection. They're just in close contact to those uterine tubes. And they're surrounded by something called fimbriae. And basically, they sort of shoot the egg off into those fimbriae, and then the egg travels down the tube. Now, these ovaries are going to be secreting estrogen and progesterone in addition to making gametes for the female's, the woman's reproductive life. And in addition, the ovaries, notice that they do have some ligaments, and those ligaments are actually going to be holding them up. So the one that's shown here is the ovarian ligament. That goes from the uterus to the ovary. There's another ligament that's called the suspensory ligament, and that's going to go from the ovary to the pelvic wall. Remember that once we get into the ovary, now we're looking at the development of oocytes through the follicular stage, and also we're looking at that corpus luteum and that corpus albicans. And this is actually all information that's included in a separate video. I do want to discuss just a little bit more about the female genitalia, because I did kind of the major structures, but I didn't get into sort of these structures down at the bottom, which is the internal part of the external structures. So this guy right here that looks kind of like a whale is part of the clitoris, and it's the internal part of the clitoris. So it's actually a really large structure. And one thing that you may notice is that this part of it is called the corpus cavernosum. And the corpus cavernosum, if you'll remember, is part of the shaft of the penis as well. So again, we have this place where the male structures and female structures actually do have some overlap. And by the way, that corpus cavernosum in males, or in men, is involved in, it's an erectile tissue. So it gets engorged with blood when there's arousal. Same thing happens to the female corpus cavernosum. There's also this vestibular bulb, which is also known as the clitoral bulb. And this is also erectile tissue that's going to get sort of engorged, and that actually helps it heighten sensitivity. As we mentioned earlier, there are these teeny little glands here. These are called Bartholin's glands, or greater vestibular glands. And what they're going to do is secrete a lubricant. One of the pathologies that can happen is that the place where these glands exit into the vestibule can get clogged. And when it gets clogged, these glands can actually swell up. And that can get to varying degrees of discomfort depending on how far it goes before it's addressed.